Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the Civitas National Conference, where there's a meeting of the minds for the health information exchanges of the country. Tell me a little bit about yourself and what trends you're hearing about in the Civitas hallways.
Yeah, great. Thanks for having me, first of all. And I'm Jason Buckner, and I am at my maybe eighth Civitas Conference, formerly Chic. So I've been around these for a long time. I'm really happy with how the conference has grown and matured. The themes are evolving. Certainly the big theme that I've noticed that's changed from historically is folks talking about non-traditional healthcare data. There are so many sessions on CIE and social determinants of health and all of these areas that are like non-traditional healthcare that are really exciting because they do impact people's health. And so that's really exciting to see. Some of the other themes that we'll see are the government shutdown. So not a great theme, but people are a little anxious about what that might mean for funding for health IT and folks. And the other, of course, is AI. I'd be remiss if I didn't mention AI. And I think for the health information exchange community, we're still in the early phases of figuring out how can we harness this powerful technology of AI in our use cases.
Absolutely. And what challenges do you think are the most prominent when we're thinking about social drivers of health and incorporating that data into normal health data that folks are using for care decisions and more?
Sure. So in the classic health space, we've had long-standing standards since the 1970s of how data should be exchanged. Those simply do not exist for social determinants of health. The Gravity Project is doing some great work, but adoption is very low at this point. I think the other factor is that these organizations, these CBOs, they just don't have funding. And so they struggle to provide the core services that they're trying to provide, such as housing, electric assistance, and various things on their own. And then we come into their space and try to incorporate technology, and their expenses just don't align with that.
Interesting. What do you think the solution is? What is the next step?
Well, I think, so our HIE functions in the state of California, and California used their 1115 waiver in a novel way to essentially pay for using Medicaid funding to pay for services outside of the traditional healthcare space. So if you are getting someone housing and they're a Medicaid member in California, you can actually bill for that, right? And consulting for those services. Now, that's slated to end next year, but that I think is a way that would help. I don't think that the industry can stand on its own. It needs some form of government funding for these CBOs to exist.
Well, thank you so much for joining me today. It was awesome to learn from you.
Great, thank you.